Good afternoon, and welcome to the Bureau of Disability Services Provider and Case Manager webinar. I am Shelley Thomas. I am the Outcomes Management Director for BEAD, and I'm your host for today. Right. Before we get started, a couple of reminders. How to use live captions. To turn on live captions and subtitles, select Captions or Subtitles on your video controls. To change the caption language, select Settings, and then Caption Subtitles, and choose the language you want. Agenda for today, we're going to share some updates for all providers, then some updates specific for the health and wellness and traumatic brain injury waiver providers, then updates for the community integration and habilitation, as well as the family supports waiver providers, go through some trending questions, and then talk about future webinar topics. All right, provider and case manager updates, which are applicable to all HCBS providers. Incident reporting follow-ups. Avoid duplicating previously submitted content. In other words, please do not copy or paste narrative or follow-up information from earlier submissions into new follow-ups. All prior content remains accessible for us to reference. Repeating information may cause system delays and email delivery issues due to platform limitations. Help us process your submissions efficiently by providing only new and updated details. Provider and case management use of recording. Recording restrictions. No interactions, including face-to-face visits, team meetings, or other communications, may be recorded via audio or video without written consent from the individual and their legal guardian, if applicable, and the Bureau of Disability Services. Agency responsibilities include agencies must have clear policies and protocols that comply with HIPAA and privacy laws, define where and how recordings are stored and specify who has access, and outline how recordings are shared, used, and protected. Best practice guidance. Recording should not be a routine practice. Please consider alternative approaches to resolve conflicts, such as involving a BEADS representative. Level of Care Assessment Representative, or LCAR, updates and reminders. Through feedback from case managers and FSSA, Maximus is updating their envelopes to add the FSSA logo. We anticipate this change to offer a level of assurance of legitimacy to the individuals and their families receiving mail regarding the nursing facility level of care assessment. We appreciate the case managers who are taking the time to inform active waiver individuals and families 90 days prior to the NFLOC ending about LCAR reaching out to schedule the reassessment. Currently, FSSA and LCAR are working on how to transfer waiver case management contact details from the BEADS portal to Assessment Pro. This will enhance better coordination with the individual or family may not be responsive to LCAR to schedule the reassessment. While this functionality in the system is not yet operational, we encourage the waiver case managers to continue to inform individuals about the upcoming reassessment with LCAR. Also, independent case management organizations currently cannot access LCAR NRI assessment. Since you do not have access to the system, please know that BEADS is working on a solution. If you need access to an assessment, please email beads.scphelp fssa.ia.gov. The secure email must contain the individual's last and first name and their RID or the PID from the portal. Case management engagement with hearings and appeals. BEADS has received inquiries from case management organizations about their role and responsibilities with hearings and appeals. Before we talk about your expected role and responsibility, we need to remind you of what an appeal is. An appeal is a written expression by the individual, parent of a minor child, or legal representative indicating a disagreement with any adverse action taken by the Division of Disability, Aging, and Rehabilitative Services or the Bureau of Disability. Case managers need to be reminded about being conflict-free requirements. That means the case manager may not file an appeal or appear at an appeal hearing on behalf of the individual unless the case manager is the Medicaid authorized representative noted on the individual's record with the Division of Family Resources. All right, provider and case manager updates for the health and wellness and traumatic brain injury waiver. Background check. As a reminder, providers must ensure that a lifetime limited criminal history is obtained from the Indiana State Police Central Repository prior to providing direct care to individuals. This includes family caregivers. Additionally, verification must be obtained from the nurse aid registry to verify there are no findings. Self-direction changes. As previously announced, the Bureau of Disability Services has proposed a series of changes to the health and wellness waiver that, if approved by the Centers for Medicaid and Medicare Services, will go into effect on 12/31/2025. This includes changes in self-directed services. A person who self-directs their services acts as the employer. Individuals will now be able to self-direct 3 services: attendant care, skilled respite, and home and community services. The Participant-Directed Home Care Service Pilot, or PDHCS, will be discontinued in favor of a broader set of self-direction options. Individuals who self-direct will have the ability to decide how much their support workers are paid within certain predetermined limits. Individuals can recruit, hire, train, and supervise their employees as they see fit. The parents of minors, spouses, and legal guardians cannot be paid for providing self-directed services. Waiver participants are not required to self-direct these services. It is an option for those who choose to do so. Traumatic brain injury waiver service definition changes. As previously announced, the Bureau of Disability Services has proposed a series of changes to the traumatic brain injury waiver. If approved by the Centers of Medicaid and Medicare Services, this will also go into effect on 12/31/2025. This includes the service definition changes as follows. The Home Health Agency license requirement will be removed from attendant care, home and community assistant, integrated healthcare coordination, specialized medical equipment and supplies, and transportation. Personal Service Agency licensure is still required for attendant care and home and community assistance unless the person is self-directing these services. The Supported Employment Services definition will be revised to align with the extended service definition on all the other waivers. Documentation requirements for attendant care are updated to hourly instead of once daily. The residential-based habilitation definition has been revised to allow individuals living with housemates to use a shared staffing model. Home modification and home modification assessment has been combined into one service per CMS's request. Both functions will still exist, however, they will exist under a single service. Updates for the community integration and habilitation and family supports waivers. Don't forget, a provider system administrator must log into the BEADS portal and confirm the provider profile information at a minimum of every 90 days. All CIH and FSW providers are responsible for ensuring their provider profile remains accurate, and the provider attestation is a simple, effective way to do so. The provider profile information always should be updated anytime there is a change in the provider profile. Completing the provider attestation is an opportunity to ensure your provider profile is accurate. This includes checking addresses, emails, phone numbers, services, counties, and contacts. This can also include changing portal assignments or adding, removing employees or former employees. This helps to protect your agency and the private health information of those you support. For assistance with completing the provider attestation, please refer to the BEADS portal user guide for providers located in the resource section of the BEADS portal under the user guides tab. Home and community support professional training and registry. FSSA launched a statewide training curriculum, platform, and direct support professional registry. The system went live on July 1st, 2025. Many providers and home and community support professionals, or HCSPs, have completed the training and registered. If so, thank you. As a reminder, all HCSPs must be trained by January 1st, 2026, which is fast approaching. If you are an organization who employs HCSPs providing applicable services and have not registered, please fill out this administrator survey immediately and then email hcsptraining@sierrahealth.com stating that you have completed the survey. This will allow our support team to set up your group with the appropriate admin access and share instructions for getting your learners started with the training program. The administrator survey is also available from the DARS website. Additional HCSP reminders. If HCSPs are trained on a provider's current training platform, they will need to be retrained using the HCSP platform before January 1st, 2026. Please note, this could mean that applicable HCSP staff are taking 2 trainings prior to January 1st, 2026. Their employers require training and this required HCSP training. Remember, an HCSP cannot provide the applicable CIH and FS services post January 1st, 2026 without successfully completing the training, receiving their certification, and appearing on the registry. More information about the medication administration curriculum training will be provided shortly. For now, providers should continue using their existing medication administration training processes as required by current regulations. We are pleased to announce that the HCSP training program is now available in Spanish. Learners can have both the English and Spanish learning paths active simultaneously. Once the Spanish learning path is activated, learners will be able to access the Spanish content and earn their certification through the Spanish learning path. If you have learners who would like to complete the HCBS training and certification in Spanish, please contact HCSP Training at sierrahealth.com for step-by-step instructions to activate the Spanish learning path for them. Train the trainer for Core A and B medication training. The final Train the Trainer Core A and B medication training of 2025 will be held virtually on Friday, December 5th, 2025 from 10 a.m. to 4 p.m. Note that registration is required. 2026 dates will be announced soon. The attendees should have the following educational materials with them during the class: the Introduction Core and A-B Summary, Evidence Tables, 2020 Core A training materials, and 2020 Core B training materials. Registrants must submit proper identification confirming employment with a BEADS approved provider of disability services and confirmation of being an active licensed nurse, either an RN or LPN, in the state of Indiana prior to attending the training session. This information can be submitted to Celia Bartel at celia.bartel@fssa.in.gov. If you are a BEADS approved provider in registering for a nurse, please make sure they understand they will need the Living in the Community Medication Administration Manual, a current LPN or RN license, and identification showing that they are an employee of a BEADS approved provider. These items must be submitted prior to the date of the training session to attend the training. Behavior Support Services Guidance. The Bureau of Disability Services has submitted waiver amendments for our home and community-based waivers to CMS for approval. Once approved, these waiver amendments will go into effect on 12/31/2025. These changes include a restructuring of behavioral support services funded through the Community Integration and Habilitation and Family Supports waivers. These changes specifically include: 1, subcomponents designed to provide flexibility and enhance person-centered delivery. 2, hour limits to each subcomponent to support alignment with the goals and purpose of this service. And 3, limitation for one behavior support services provider to provide both direct behavior support services as well as clinical supervision. As a result of these changes, providers of behavioral support services must meet qualifications for and be approved to provide both direct and clinical supervision, which is currently the BMGO and BG10 services, prior to 12/31/2025. BEADS has reached out to currently active providers who do not currently meet these requirements to provide guidance on the path towards successfully meeting qualifications to meet the standards and qualifications to provide both direct and clinical supervision to be approved to provide behavioral support services as defined in the 12/31/25 waiver amendment. BEADS appreciates that many providers have already successfully met these qualifications and will be approved to provide behavioral support services on or before 12/31/25. Behavioral consultant eligibility. A behavioral consultant, in other words, a rendering provider of the direct service of consultation, functional behavioral assessment, of comprehensive behavioral support within behavioral support services, must have a master's degree in clinical psychology, counseling psychology, school psychology, or another applied health service area of psychology. Special education, social work, counseling, applied behavior analysis, or be a licensed marriage and family therapist licensed under IC 25-23.6-8. Be a licensed clinical social worker under IC 25-23.6-5. Be a licensed mental health counselor under IC 25-23.6-8.5, or have a master's degree in human services field and be able to demonstrate to the BEADS provider services that the individual has either coursework in or 5 years experience in devising, implementing, and monitoring behavioral support plans. Behavior Support Services additional guidance. BEADS recognizes that some current behavioral support service providers may determine that they are unable to meet these requirements and/or may choose to voluntarily withdraw as a waiver provider. BEADS is ready to assist you in successfully deactivating from the waiver program. This includes notifying BEADS provider services in writing 60 days prior to the planned deactivation at BEADS provider services at fssa.in.gov and requesting deactivation in the BEADS portal. Providing a 60-day notice to all individuals impacted by the deactivation, along with their case managers in writing. Ensuring that all individuals are successfully transitioned to a new provider meeting the qualifications to be a provider of behavioral support services. Notifying IHCP of the deactivation, if applicable, deactivating as a Medicaid provider. Any providers remaining active on 12/31/25 who do not meet the criteria to be a provider of behavioral support services will be notified in writing of BEADS' intent to terminate the agency from being a provider of behavioral support services. If you have additional questions regarding the upcoming changes for behavioral services in Indiana's CIH and FS waivers, you may contact beads.help@fssa.in.gov. Guidance on usage of transportation services. The Bureau of Disability Services is issuing the following guidance to clarify the appropriate use of transportation and residential hab and support services under the Community Integration and Rehabilitation Waiver Program. TRNO, or Transportation Services. As outlined in the Section 10.31 of the DARS HCBS Waivers Provider Reference Module, all individuals are eligible to participate in non-Medicaid waiver transportation services. TRNO is intended to support access to community-based services, employment, and other PCISP-related activities. TRNO should only be used when non-paid transportation options have been exhausted. This includes natural supports such as family, friends, or community resources. Case managers are responsible for engaging teams in conversations about available non-paid support before authorizing TRNO. Document justification for TRNO use, including why unpaid options are not viable. Ensure TRNO aligns with PCISP goals and does not duplicate other Medicaid-covered transportation services. RHS, or Residential Rehabilitation and Support. RHS provides support for individuals living in their own homes, focusing on skill building and safety. These supports include adaptive skill development, assistance with activities of daily living, community inclusion, transportation, adult educational support, and social and leisure skill development that support the individual to live successfully in their own home. While RHS recipients are not prohibited from using TRNO, BEADS encourages thoughtful planning to avoid unnecessary overlap. Case managers are responsible for reviewing RHS service plans to determine if transportation needs are already addressed. Coordinate with teams to explore natural supports for transportation before authorizing TRNO. Reinforce that RHS and TRNO must serve distinct purposes and be documented accordingly. Expectations on usage of transportation services. So to summarize the expectations, prioritize non-paid supports wherever possible. Ensure clear documentation of service need and alignment with PCISP goals. Avoid duplication of services across TRNO, RHS, and other waiver support. Maintain open dialogue with teams to promote responsible service planning. For full service definitions and limitations, refer to the DARS HCBS Waivers Provider Reference Module. Please share this guidance with your teams and reach out with any questions or case-specific concerns. Strengthening Indiana's HCBS program. BEADS, in partnership with its network of service providers, shares a collective responsibility to uphold and administer home and community-based service programs that are sustainable, high quality, and person-centered. Together, we ensure that individuals with disabilities are supported in living their good life, defined by choice, dignity, accountability, and meaningful inclusion in their communities. As part of our proactive stewardship of these programs, it is essential that we consistently and thoroughly conduct reviews of cases where an individual support team has presented substantiated evidence of an individual support needs and received authorization for funding beyond what may be necessary to ensure health and safety. BEADS is encouraging case managers and service teams to actively partner with us in conducting comprehensive service plan reviews for individuals receiving waiver services. This includes individuals whose current service funding is significantly high and in some cases exceeds their assigned waiver allocation. Collaboration with providers is essential to assess the intensity of services and ensure alignment with funding requirements. Your engagement as a provider is critical to the success of these reviews. When appropriate, case managers will reach out to your organization to coordinate individual support team meetings. These meetings will focus on evaluating the individual's current health and safety needs, identifying opportunities for integrated support, developing a thoughtful, person-centered plan that continues to meet the individual's health and safety needs, promoting fiscally responsible stewardship of Indiana's HCBS programs. These discussions may include, but are not limited to, adjusting 1-on-1 or 2-to-1 staffing levels when documentation does not demonstrate the need, obtaining a housemate when one does not exist but is determined to be appropriate, identifying and leveraging informal support, community resources, and prioritizing the use of state plan services, implementing remote support technologies where appropriate, developing a plan for reducing restrictive measures and increasing compliance with HCBS settings rules. BEADS appreciates your commitment. BEADS also appreciates your ongoing partnership. Together, we strive to responsibly and compassionately connect individuals with the resources they need to live as independently as possible within their communities. If you have individual-specific questions, please reach out to the individual's case manager. For general inquiries about service plan reviews, contact beads.help@fssa.in.gov. Now we are going to talk through some of the November 2025 trending questions. Question 1 for the FS and CIH. Can a licensed BCBA provide clinical supervision for behavioral support? Answer. To provide clinical supervision for behavioral supports, a licensed BCBA would have to meet one of the following. A clinical supervisor or a rendering provider of clinical supervision component of behavioral support services must be a licensed psychologist under IC 25-33 and have an endorsement as a health service provider in psychology or BNHSPP, or have at least 5 years supervising the work of behavioral consultants providing behavioral support services in home and community-based settings with one of the following endorsements: being a licensed clinical social worker under IC 25-23.6-5, a licensed marriage and family therapist licensed under IC 25-23.6-8, or a licensed mental health counselor under IC 25-23.6-8.5. Question 2. Will there be additional training and resources related to the upcoming behavioral support changes? Answer. As noted in the BSS Transition Guidance document located under the Resource tab of the BEADS portal, additional materials such as Behavior Support Services Quality Guide, state-approved templates for the consultation plan, functional behavior assessment, behavioral support plan, and quarterly report are forthcoming. Question 3 for the H&W and TBI. I'm an H&W provider and need to update our agency contact for NOA notifications. How do I do this? Answer. Requests to update agency contacts, email addresses, or phone numbers can be submitted directly to BEADS Provider Services at beadsproviderservices@fssa.in.gov. If you need to update your mailing address or physical location, this should begin at the OMPP Provider Certification Portal. Once processed by OMPP and IHCP or Medicaid, BEADS will receive this information and will update the information in the BEADS portal. Question 4 for the FS and CIH. I'm a new provider and I don't really understand the Quality On-Site Provider Review. Can you explain it? Answer. The Quality On-Site Provider Review, or COPR, is used to ensure the quality of the home and community-based waiver services individuals receive. The tool is organized around charting the life course domain and includes indicators which will support BEADS in determining if individual outcomes are being achieved, as well as provider compliance with the HCBS settings rule. The COPR review process includes a 2-day on-site review conducted by a quality reviewer. They have conversations with the individuals, support staff, supervisors, and management. They'll also review key documents to ensure provider standards are being met. The review includes a wrap-up meeting to discuss results and an opportunity for the provider to request technical assistance and training. The provider will receive the final report, as will key members of the BEADS team, including quality assurance and BEADS provider services. Future provider webinar topic ideas. The BEADS provider webinar primarily offers an opportunity for BEADS to share current news, updates, and to offer brief training opportunities. But we want to hear your ideas about additional webinar topics that would be helpful to you across the H&W, TBI, CIH, or FS waivers. This webinar is a monthly opportunity to discuss updates and issues impacting Indiana's HCBS waiver providers and other providers of services administered by DARS. Share your topic ideas at BEADS Provider Services at fssa.in.gov. Thank you. Our next provider and case manager monthly webinar will be held on December 30th, 2025 at 3 p.m. Eastern Daylight Time.